I'd like to begin. I'd like to begin with an acknowledgement to the land I'm currently sitting on as I speak to you from Windsor, Ontario. This was the traditional territory of the Anishinaabe people of the Three Fires Confederacy, which consists of the Ojibwe, Potawatomi, and the Dogwe. Everyone is encouraged to reflect on the city that they're joining from, as we're joining from all over today. So welcome to the first webinar of our three-part series, The Environmental Injustice of Beauty, hosted by the Environmental Noxiousness, Racial Inequities, and Community Health Project, also known as the ENRICH Project. The ENRICH Project is a unique and innovative project that was established by Dr. Ingrid Waldron in 2012 to address the social, environmental, political, and health impacts of environmental racism in Mi'kmaq and African Nova Scotian communities across Nova Scotia. In 2020, the ENRICH Project became a project on Makeway's shared platform and expanded its scope to examine and address both environmental racism and climate change impacts in Indigenous, Black, and other marginalized communities across Canada. In fall 2022, the ENRICH Project launched the social media campaign, The Environmental Injustice of Beauty, which aimed to build awareness among diverse Canadian youth and the broader public about the adverse health effects of toxic personal care and beauty products through education, information sharing, and storytelling on various platforms, including Instagram, TikTok, and Facebook. These webinars aim to expand on this campaign through bringing researchers, health professionals, activists, and community members together in conversation about the adverse health impacts of toxic personal care and beauty products in a three-part series. Through these three webinars, we will be discussing the cumulative health effects of daily toxic exposures, how colonialism influences toxic exposures for racialized people through white and Eurocentric beauty standards, how lax regulations and a lack of transparency from industry contribute to toxic exposures, and lastly, how to advocate for change. Ultimately, we hope to expand awareness on these important topics and encourage individuals to take tangible, change-oriented actions within their own communities in advocating for safer products, challenging white beauty standards, and holding industries accountable. Because we just want safer products. We hope you enjoy this conversation. Please put any questions that come up and stimulate your brain during the webinar into the chat. So in today's webinar, we will be discussing the cumulative health effects of toxic personal care and beauty products. We are joined by three amazing speakers, Anna-Liza Badaloo, Jennifer Beeman, and Reena Shadaan. Reena Shadaan is the Mustard Postdoctoral Researcher at the Institute for Work and Health and a researcher at the Environmental Data Justice Lab at the Technoscience Research Unit, which is at the University of Toronto. Shadaan holds a PhD in Environmental Studies from York University and a Master's in Gender Studies and Feminist Research, all from McMaster University. Her work intersects environmental, occupational, and reproductive health and justice. Jennifer Beeman is the Executive Director of Breast Cancer Action Quebec, an intersectional feminist environmental health organization whose mission is the prevention of breast cancer and other diseases. She has been central to developing BCAQ's work on the Canadian Environmental Protection Act and toxins reform, in addition to educating and mobilizing women's groups and health groups across Quebec on a range of environmental health issues. Anna-Liza Badaloo, she, her are her pronouns, is a queer Indo-Caribbean journalist, facilitator, and organizational consultant working at the intersection of health, environment, and social justice. Committed to amplifying diverse voices, her work uncovers how colonial, capitalist, heteronormative, and ableist systems disproportionately impact underserved communities. She is an associate with the Sustainability Network, building environmentally nonprofit capacity using justice, equity, diversity, and inclusion principles, also known as JEDI, and is a regular contributor to magazines including QBiz, She is Wise, The Monitor, and the Aboriginal Business Report. Now, my name is Josie Alicia, and I'll be your moderator. I'm a social media influencer and content creator, primarily on Instagram, and I'm also an instructor at St. Clair College. A friend of mine actually introduced me to the ENRICH Project, and I was very intrigued by the topics that they were investigating. I went on to collaborate with them as an influencer to help amplify the message of the Toxic Beauty campaign on social media. So I got to create a lot of cool content for them on Instagram and TikTok that incorporated trendy memes, dances, and audios as a way to captivate a younger audience and get these women thinking about the long-term effects of the products they use and put in their bodies. But now let's hear from our speakers. So, how about we have you guys introduce yourselves and why this topic is so important to you? How about we start with Jennifer?
Okay. Thank you, Josie. Hi, everyone. It's genuinely an honor to be here, and I'm really looking forward to this conversation. I'm coming to you from Tiohtià:ke, commonly known as Montreal, where the Kanien'kehá:ka Nation is recognized as the guardian of the lands and the waters. Um, why I'm why I and we are so passionate about this work, and I think it stems in my case from getting involved in the women's health movement in the 80s when breast cancer rates were really on the rise. Mortality rates were still relatively high. Women were dying from the disease and treatment was often brutal. And it created an awareness of why is this going up? What that means something is changing in society. And then later, after an arc of my career, I came Breast Cancer Action. There was a position open, and I really wanted to come back to this. And health advocacy is it's based on the observation that women's interests, and particularly women from racialized communities, are never served by putting our interests in the hands of experts or solely of experts. We really have to look out for our own interests. And we do that by reading the emerging science and asking and translating that, bringing that to politicians and saying, these are the emerging issues. What are you doing about that? You have a role, you have an essential role in protecting our health and protecting the environment. And why is that not happening? And so the work is more vital than ever, and the communities that we work with are more diverse. The issues are more challenging, and it's just such an important place to be. The issues have never, and we'll get into the kind of the details of the health issues. It's serious, and so that's why I'm here, and that's why we do what we do.
Thank you so much for sharing that, Jennifer. We really appreciate it, and we're grateful for having you here. So, Reena, can you please introduce yourself and tell us why this topic is so important to you?
Sure. Thank you so much, Josie, for the wonderful introduction. So I'm speaking to you all from Treaty 19 territory, the traditional lands of the Haudenosaunee, Huron-Wendat, and most recently the Mississauga of the Credit First Nation. As Josie mentioned, my work sort of broadly intersects environmental and occupational health and justice, with like a particular focus on toxics. For me, this focus was really crafted in my past extensive work with survivors of the Bhopal gas disaster. So for those unaware, the Bhopal disaster occurred in 1984 in central India. A pesticide plant leaked a toxic substance called methyl isocyanate, which has killed thousands to date, led to rampant chronic health issues and various intergenerational implications. So my experience in Bhopal and with survivors is is the basis of my commitment to safe and healthy environments where we live and also where we work. It also really attuned me to issues around disproportionate and uneven exposures, where those at the intersections of various oppressions deal with persistent intergenerational and cumulative harm to their bodies and to their environments. In terms of the nail salon specifically, I came to this issue through my connection to Anne Rochon-Ford. So for those of you who don't know, Anne is a powerhouse in women's health advocacy in Canada. And fittingly, Anne is a longtime member of the Healthy Nail Salon Network, which is housed in the Parkdale Queen West Community Health Center. The Healthy Nail Salon Network is a collaboration of nail technicians as well as folks in environmental and occupational health. And the aim is to foster safer, healthier nail salons. So in my interactions with Anne, she shared that there was little Canada-based research on nail technicians' experiences. So as a community-based researcher committed to doing useful research, I decided to work with the network to craft a research agenda that supports their aims. This became the focus of my PhD dissertation, which used worker-centered methods to understand the hazards and health implications associated with nail salon work. In addition, I traced select toxics in popular nail products to their roots in petroleum extraction and petrochemical production, and that later. In terms of the importance of the nail salon case study, there are many reasons why, but there's two issues that I want to just highlight briefly. So first, the nail salon is an important site to understand and attend to the experiences of newcomer and immigrant women workers. So in the Greater Toronto Area context, nail technicians are most often women of Chinese, Vietnamese, and Korean descent. And their work reflects what is called the racialized gender division of labor, where precarious, low wage, and undervalued labor, including service and care work, is offloaded to newcomer women of color. There's various factors that underlie this: language barriers, discrimination, lack of local work experience, social isolation, disproportionate household responsibilities, and so on and so on. And all these sort of factors intersect to impede access to safe, fair, and well-compensated work. In turn, precarious work can lead to illness and injury. So, for example, think about workplace injuries due to inadequate PPE or lack of safety training. Second, I believe that it's vital to center those working in the beauty industry. In this webinar series, I anticipate that a lot of folks will highlight the impact on consumers and consumer advocacy. And while I agree that consumer level exposures are important to attend to, it's vital to remember that workers' day-to-day exposures far outweigh those of consumers. And I hope the work I present today sort of makes that point clear.
Thank you so much, Reena. That is so intriguing. Something that, I feel like a lot of women go to nail salons, but we never really look at it from the other perspective. And that's something that I'm intrigued by. And finally, Anna-Liza, can you please tell us a little bit about yourself and why this topic is so important to you?
Absolutely. Thanks so much, Josie, for being our awesome moderator. It's a pleasure to be here with Reena, Jennifer, and of course, all of you joining us today. Reena, I'm really glad that you mentioned Bhopal, because that actually is something that really sparked my interest in this. When I was growing up, when the Bhopal incident happened in the early 80s, I was quite young, and it made a real strong impression on me. There were a few things that happened in that decade that involved toxins, but with Bhopal being somebody with, an Indo-Caribbean background, just the news coverage alone, just seeing these, burned brown bodies, coming out of here for something that, if you look into the story of Bhopal, you'll see there was a series of events that kind of led to that. But that happened, and I just went through my whole childhood seeing these events, the Exxon Valdez oil spill, all of these things where toxins were getting out there. And at a really early age, it came to me that racialized people, low-income people, a lot of people are being disproportionately affected by that. And that's simply not right. And that's simply not acceptable. And as I was going through my younger years, I myself actually have chemical sensitivities. So when it comes to personal care products, what I experienced, although I didn't realize what was happening until years later, when it comes to things like perfumes and nail polish, that is, I'm going to get a headache right away. And this isn't in the past, this is now, this is still the case. There's things that these toxins for people like myself that are a little bit more sensitive than some other people, we pick up on this right away, and it's not pretty. I've been in maybe meetings with people that are wearing a strong perfume, and I know I'm not showing up as my best self because I can't think properly. getting a little irritable. There's all these impacts that happen. And, as I was going through and seeing all of these, how toxins are really impacting people, I decided to study to become an herbalist. And that's when it really hit me, when I started learning how the body really works and how hormones really work and so on. And then I thought, oh, this is a much, much more serious issue than I thought, not only because they're in these products, but people don't know that they're in these products. And that, of course, is still happening today. So when I studied that, I came to realize this, and that really started my own natural beauty journey, because from that point on, and this is going back to the late 90s, by the way, when I was studying to be an herbalist, I automatically right there just started researching intensely. How can I replace the products that I'm using? We're talking about personal care products today, but it was a whole household effort for me. It was cleaning products, it was everything. And, as I got later into my life and I started getting into writing and getting into research, then again, the information was coming out strongly. And again, racialized people being disproportionately impacted. Myself being from a Caribbean background, we love to look good, right? If there's any of my Caribbean people here tonight, the perfume, the makeup, right? It's really a cultural thing. And when you're dealing with, white supremacist environments, as we mainly are in Canada, there's a lot more pressure, right, to look good in that way, to wear these things. But also the income might not be where it is for some other communities. And essentially, sadly, unfortunately, it's cheaper to buy toxic products. And you want to buy better products, it costs more. So all this to say, this is really why I'm very interested in this issue, because as you mentioned, Josie, I am working at the intersection of health, environment, and social justice. And frankly, this is an issue where I really feel all of these things come together.
That is so poignant. And I love that you are involved with natural products. I mean, we're starting to see more of a movement towards natural products with some of the bigger brands hopping on that trend. I love that you were doing that from the 90s. It is so important because yeah, we don't have enough of that, especially in racialized communities. So thank you so much for sharing. So getting into some of our specific questions that's going to delve a little deeper into your guys' research, because I'm sure our audience members would love to hear more about what you guys are doing. Jennifer, what are the links between toxic personal care products, cancer, and other diseases? And I mean, you can speak specifically to your work with breast cancer action.
Sure. So regarding our work, so as I explained, we monitor the emerging science on breast cancer and then kind of related illnesses and toxic substances. And from about 2015 on, we saw the emergence of literature that showed that breast cancer, that it was on Black women in particular, and the category isn't better defined than that, but that Black women were being diagnosed with more aggressive forms of breast cancer at a younger age and at higher mortality rates. And this was research coming out of the US, but also the UK. And when it comes out of the US, they control very carefully when they're comparing an African-American population with a white population for access to healthcare and socioeconomic status and region and everything else. So this was just terrible, like very distressing research to see. And it wasn't one piece of researcher. This was a number of different, excellent research teams producing this and really raising the red flag. And then in 2016, 17, we saw the emergence of research that showed that personal care products specifically aimed at racialized women, particularly Black women, contained more toxic substances and in higher proportions than the same kind of products that were geared towards white women. And then in about 2019, we've seen these two research strands converge, where researchers, and again, it's not just one or two teams, we're talking about quite a number of publications at this point, are looking to examine whether this whether there's an association between the exposure to these toxic products and the trends that we're seeing in breast cancer, particularly for Black women. And the research goes both ways. There is research that says yes, particularly for hair dyes and hair relaxants. There's some research. That's what happens with science, is that depending on how it goes both ways. But what is really important is we're seeing the same thing emerge right now regarding uterine cancer. And again, this is just, the alarm bells are ringing at Breast Cancer Action over this, because we've seen this before, and it's already serious regarding breast cancer. Uterine cancers, the incident rate, it's on the rise. Mortality rates are on the rise. Something is changing in society that is creating this. And then now the same research that shows that Black women, the same thing, more aggressive forms at younger ages and higher mortality rates. And this is serious. This is really alarming, distressing research trends that we're watching. In addition to, it's basically everything that concerns what we call an ovarian reproductive system, as endocrine disrupting chemicals, and people can explain what those are, interfere with the hormone system. And because we have a monthly cycle and just a different reproductive system, there are more organs, there are more conditions that can be to which endocrine disrupting chemicals increase the risk for those things. And so I can put it in the chat. We produced, as we'll get into, regulation of this stuff, but there's a bill being examined to reform the Canadian Environmental Protection Act that regulates toxic substances and will give us the right to a healthy environment. And we wrote a brief that looks at all of these from, it's called Gender, Race, Sex, and Toxics, and along a range of illnesses: fibroids, endometriosis, polycystic ovarian syndrome, breast cancer, uterine cancer, ovarian cancer, early onset puberty, among other things, and such similar trends across the board all of these are associated with exposures to endocrine disrupting chemicals, and all are more severe for racialized women from racialized communities. And so that is where our work is now on these issues. So yeah. Oh, and as we get through the whole work on the reform of the Canadian Environmental Protection Act, I think we're going to sit back and go, what do we do now? We really just brought a whole number of new threads, like new strength to our work, and now we have to do something. We have to do much more with this. So I'll leave it there.
Thank you so much. I mean, it's a little bit scary to hear. Sorry.
Yeah, it is. It's distressing, scary, and I don't want it. And so we need to come around to ways of it not just being disempowering and scary. It's wrong. This is environmental injustice. This really is. And in 2017, a really important publication was made called "The Environmental Injustice of Beauty" that put this on the map. And I'll put in 2 links in the chat for this important publication that has now also become quite a field, and our brief that offers you're limited to 10 pages, so it's very succinct as we go through these things. But yeah, we need to get it to a more empowering place, but it is hard to take in that information.
Mm-hmm. It's a hard truth, but it's one that people definitely have to face. I know growing up in a very diverse community, how you wore your hair was always really important. Some girls would relax it at very early ages. Some girls didn't. I wasn't allowed to relax my hair until much later. But now hearing all of the crazy diseases that come with relaxers, I'm not doing that anymore. Hence the braids.
it increases risk. Our position is people get to, we don't judge anybody, and we, choosing how we present ourselves to the world is a basic right. We just, like you said it right off the top, we want non-toxic products is what we want. Exactly. And so that's what it's about.
Exactly. Thank you so much. Your work is very much needed. Oh, my Lord. So Reena, I'd love to hear more about the nail technician. So please tell me about your findings from the work-centered participatory action research you conducted with nail technicians, and how this highlights the intersections of environmental, occupational, and reproductive justice.
Sure. Thank you, Josie. Just thank you, Jennifer, too, for sharing your work. That is so distressing, but also so vital in terms of creating a path moving forward to sort of healthier futures. So in terms of my work, I'm going to start by sort of describing the method a little bit. So from 2019 to 2020, I led the facilitation of 3 mapping workshops with a total of 37 nail technicians based in Toronto. The workshops were co-facilitated by the Healthy Nail Salon Network and the Nail Technicians Network. All the participants identified as women. They ranged in age from young adults to seniors. And with the exception of one person, all participants identified as of Chinese, Vietnamese, or Korean descent. We started the workshop with something called body mapping. So this is where workers identify sites of illness or injury on like visual representations of human bodies. To do this, the participants were divided into small groups based on first language. Each group was given a blank body map and stickers to indicate health issues related to their work. So for instance, if you felt that if your issue was having a sore throat, you would place a sticker then on the throat of this like visualization of a human body. Some participants also wrote keywords on their body maps to ensure that it really fully captured their intention. So some folks wrote things like difficulty sleeping, headache, itch, cough. And then from the small groups, we came together as a large group and everyone shared sort of the health issues they had identified. So from the body mapping, we moved into something called hazard mapping. And so here workers identify the sources of their health harms within the work environment. So again, if the issue is, let's say, a sore throat, and if, you know, as a worker, you felt, okay, this sore throat, I think it's related to inhaling some of the odors from nail products, you would sort of indicate that on the hazard map. It's a little bit hard to explain body and hazard mapping without the visual, so I'm trying my best. But if I'm unclear in any way, if there's any clarity folks need, please feel free to ask. I'm happy to discuss further. So the issues identified can really be divided into 4 categories. So 1 is the lack of ergonomic conditions, 2 is sort of the conditions of precarious work, 3 was verbal abuse from customers, and 4 is chemical hazards. I'll very briefly touch on the first 3. So in terms of lack of ergonomic condition, the nail technicians identified aches, especially in the back, neck, arms, hands, legs, and feet. So you can think about the positions that nail technicians are in when they're working. In terms of the conditions of precarious work, participants identified things like increased menstrual pain, headaches, difficulty sleeping, pressure in the chest, various bodily aches, and mental health concerns. Many also noted stomach pain and digestive problems, and this was linked to not having a lunch or not being able to eat lunch on time. And participants further identified verbal abuses from customers as a source of stress. So given the focus of this webinar, I want to spend a little bit more time discussing the chemical hazards that they identified. So nail technicians are exposed to various toxics in nail products, some of which have been detected at heightened levels in nail technicians' bodies and in nail salon environments. This includes phthalates and volatile organic compounds, or VOCs, both of which are linked to adverse health outcomes. In fact, one study of 6 Colorado-based nail salons found benzene, ethylbenzene, toluene, and xylene levels detected at rates comparable to oil refineries. And it's important to mention that some of the components of nail products and other personal care items, they are petrochemicals. They come from petroleum extraction, which carries its own environmental toll, particularly in frontline Indigenous communities. So the participants identified a host of health issues which they linked to their day-to-day exposure to toxics in nail products. This includes dizziness, breathing problems, stuffy and itchy noses, sore throats, cough, itchy and sensitive eyes, dry, itchy and sensitive skin, rashes, and blisters. In addition, participants were asked about their health worries, in which chemical hazards played a very significant role. They consistently identified worries related to cancer and reproductive health. This includes around miscarriages, around their ability to have healthy children. So if we think of reproductive justice, it is the right to have children if we want them in safe environments. So in this sort of context, you can see how nail technicians' work experiences sort of reflect a reproductive injustice. One worker also identified a concern around hormone disruption, right? And we know that many components of nail products, they are EDCs, as Jennifer sort of like summarized. Importantly, there is limited nail salon-based evidence of reproductive harm, an unconfirmed risk of cancer, and no nail salon-based studies on hormone disruption. However, studies have linked common toxicants in nail products to reproductive, intergenerational, endocrine, and cancer-related health impacts. So nail technicians are rightly concerned about the long-term implications of their day-to-day exposures at work. So in terms of the links between environmental and occupational justice, I think when we think about where toxics in nail products come from and their health impacts on nail technicians, we can see this link between the environment, work, and the impact, which in part is sort of reproductive health related, right? And also, I think it's important to note that sort of traditionally, environmental justice has always been about where we live as well as where we work. So the nail salon fits sort of in that framing too.
Your study sounds so incredibly interesting. And I mean, I used to love getting my nails done. I think a lot of women do. But one thing that I always found is generally later that day, I would end up with a headache. And like I am susceptible to migraines, that sort of thing. But the smell of the chemicals, whatever it was they were using, would always give me headaches. And it did make me wonder, how do they deal with this on a day-to-day basis? And I think it's a good thing that they're starting to, with your studies like yours, are coming about and actually looking at the long-term effects of what these sorts of chemicals are doing to their bodies. Because this is something that obviously, if it's affecting customers who are just coming in for an hour or two, how is it affecting people who are doing it for years and
Absolutely.
even decades, right? It's kind of crazy that we don't know yet.
Absolutely. Yeah, there's definitely, I mean, there's quite a bit of US research on sort of nail salon environments, and there's growing research based in Canada, and that's really the prompting of, you know, the Healthy Nail Salon Network and folks at Parkdale Queen West. But you know, there's need for more. There's so many blank spaces. There's so much information we don't know.
Mhm, mhm. I definitely hope that your research encourages more research in this topic area, because it's definitely needed. It's oh, I can't believe that we don't have more yet. That like it's wild to me. But thank you. So, Anna-Liza, can you please discuss your experience sourcing natural products and learning to make your own as healthier alternatives to the toxic products that exist on the market?
I sure can. First, really beautiful remarks from both Jennifer and Reena. Thanks for that. And Reena, I'm glad you mentioned this, what's sometimes referred to as the Colorado study with these nail salons. And Reena, what you pointed out, that was the thing that made the biggest impression on me too, that these nail salon workers are basically experiencing that similar levels of these toxic concentrations as people working in oil and gas refineries. This is crazy. This is absolutely crazy to me. There is actually, again, because I have these chemical sensitivities, I could never go to a salon, you know, I could never, because even the nail salons, you know, sometimes in the summertime, they might have their door open. You walk by on the street, I'd have to hold my breath even walking by, you know, it was just really terrible. And I know we're going to avoid the product placement, so I won't mention the name, but there is a salon that I now do go to in Toronto that is one of the few, if not the only non-toxic salon I know of. And it's really interesting because it's a racialized couple that owns it. And the female of the couple worked in that salon as, you know, an esthetician for quite some time before her and her partner bought the salon and now own it. And when I was there, I would be chatting, you know, with the other, my fellow salon attendees, and that's what we would talk about. I could start a conversation with anybody by just saying, isn't it great to come to a salon and not leave with a headache? Isn't it great to come to a salon and not have to wonder, like, what is actually in this? Do I trust this? I'm not sure. All of that gets taken off the table. So, you know, that's just one thing I would say to people, where whatever part of Canada or elsewhere you might be from, do a little research. You know, there are more and more of these salons that are coming out now. Now, in terms of my own journey, you know, I mentioned to you folks that when I started studying to be an herbalist in the late 90s, my mind was blown by realizing how these toxins impact people. So how did I start? Well, my journey started at the health food store. And I'm here to tell you, don't be afraid to go to the health food store, people. Don't be afraid. It's an environment that not many, you know, some people may be a bit unfamiliar with. You think it's kind of granola or hippy dippy or what have you. But if you're looking for the toxin-free, give them a look. Now, I find something that puts people off health food stores sometimes is they can be a little chaotically organized, sometimes compared to, shall we say, some more corporate types of places. Don't let that put you off, because that's what the staff are for. If you go someplace, just ask them. And why am I saying go to the health food store when I darn well know that you can order it online? Well, here's why. When you're there in the store, first of all, you can look at a lot of different products and you can take your time and you can talk to the staff. I've actually had various experiences just even chatting with fellow customers, right? If you're there and you're looking at a product, person next to you is looking at the same thing, it doesn't hurt, right? Just to ask, what's their experience? How did you find it? So, after I did that for quite some time, and this took me years, this was years and years of research, and it was years of trial and error, because, these natural products, they often don't have nice little sample sizes like you might be able to get at, the Shoppers Drug Mart or with some other products. So what that meant for me at first was it was a bit of a financial outlay, not going to lie. I had to buy a heck of a lot of products and try them out and hope for the best, and over that time, I just, got a lot of products that really worked for me. And that's not a past situation. Like I still go through that because, companies change their products all the time, right? There's a product that I was using, a very natural product for my hair, being a curly haired girl, and they stopped shipping it to Canada from the States. So I did end up sourcing, it was wonderful actually, a Black owned company here in Canada from the East Coast that has the curly haired natural stuff. So it's out there, right? It's out there. That's something that when we talk about this stuff, as Jennifer was saying, it can be a bit doom and gloom, but there are things out there that you can do. So that was in terms of the sourcing, right? But what about the making? So when I was studying to be an herbalist, this was the joy of my life to learn to make these different things, because what I learned was that it's not rocket science, it really isn't. You can have, and I'll mention in the later part of the webinar, I'll give you some examples of what these are, but there's sort of a few key products that you can have on hand. I'll mention a couple, beeswax, for example, is a great thing that you can buy in blocks. You can shave it up, you can melt it, on the stove and add all kinds of things to it. And then, of course, a big part of the toxins in regular personal care products are the fragrances, right? And the different scents. That's a big, big part of it, but not the whole story. So we can also remember that essential oils, which are a completely natural product, can certainly be utilized as well when it comes to making your own things. And I think it needs to be said too, that from the social aspect, in a professional standpoint, Josie, you alluded to this earlier, there's a lot of pressure on women and on female identified people, to look a certain way, particularly in the workplace, and this gets talked a lot about. I know I have a number of Black or melanated friends who we have these conversations all the time. So-and-so wore their hair a certain way and certain comments were made. There's a certain level of professionalism, right, that us women of color often feel, especially in the professional environment, we need to step up to. Now, how toxic is that going to be? My last remark in this section will be that I worked at a workplace several years ago, many years ago, actually, that this was long before the days of fragrance-free workplaces, right? This is a relatively recent thing. You go somewhere, you see that little sign up. And I was having these issues because this particular organization held quite fancy events sometimes, very, very fancy. And, you dress up, you do all the things. What I would find is on those days, my colleagues would just be bathing themselves practically in cologne and perfume. And then I'd roll up and I would have to be at my best, especially, maybe courting corporate sponsors, whatnot, while I wasn't. So finally, I had a chat with the executive director of the organization one day and said, this is what I'm experiencing. Is there anything? And basically, and this was, by the way, an older white female, she said to me, well, Anna-Liza, this is just what women do to feel good. When you're coming to an event, this is just how it is. This is just part of our routine. And this is just, perfume just gives us that nice little extra that just makes us feel really good about ourselves. You get it, right? Well, I didn't get it. There's a power dynamic there, right? I didn't really feel like I could speak to her about that. But at the same time, I was like, I am also a woman that also gets ready every day. I'm not sure what you're implying there. So, there's a lot of things to these issues, right? There's the chemicals themselves, but there's also all of these various things that factor in.
It must be so refreshing to you now to have, the scent-free workplace almost as like a norm. And I mean, where I work at the college, we have the posters everywhere, scent-free, 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 because we do have some people with who suffer from, I think, scent-related allergies, scent-related migraines, things like that. And it's just, common courtesy at this point. If one person suffers, then why does anybody need to cause them to suffer? It's just as simple as that. So it's unfortunate that it took this long for people to kind of become empathetic to that sort of situation, but it's nice to see that the tide is finally changing.
Yeah.
So I guess we'll move on to our third question here. We'll start back around with Jennifer. How can your work inform future change-oriented actions?
For future change, we jumped into the question of reforming the Canadian Environmental Protection Act about 5-6 years ago. And so for those who don't know, the Canadian Environmental Protection Act is our very big, broad act that is the Pollution Control Act. Anything that we create that harms our environment or harms us, that is a form of pollution, has measures in this very broad law to ensure its control and to minimize it or reduce or eliminate or mitigate or whatever needs to be done regarding the source of pollution. Big section on toxic substances, the regulation of toxic substances in Canada. And there are weaknesses in the law. When there's a regulatory system, there's always two things. There's the law, and then there's how the law is applied. And those are two different things. And so there was a study by the ENVI committee, the committee of the House of Commons that is responsible for the application of this for this law, that produced 87 recommendations of how to update this law, and finally, with a lot of pushing from environmental and health groups, this government has proposed a bill S5 to update the law. It's not as ambitious as we really would have liked to have seen. It does move some things forward. And the question that I'm asking myself, we are asking ourselves at Breast Cancer Action Quebec, is this going to change how this system of toxic regulation works? Tomorrow is probably the last day when there will be amendments to this bill S5 that will modernize the Canadian Environmental Protection Act. So we're almost most likely at the end of the process for improving this round of updating the law. After that, we'll need a movement to push the government for an excellent application of this law, because there's a lot of discretionary power in terms of how this is put into practice, and we really need to see it live up to a much higher standard in terms of controlling toxic substances than we've seen up until now. Lots of different groups are involved in this. CAPE, Breast Cancer Action, just almost all, many environmental groups. And so there's a lot of information available, but we're going to need a really broad number of people and groups, and really start to center the voices from the margin that who's not around the table, and we need to center these voices as we push for better regulations. How to do that? Because there are as both Reena and Anna-Liza have said, there are disproportional impact for racialized communities, and it's serious, and it plays out in health effects. And then just another note is that we don't collect race-based health data in Canada, and it's a very serious problem. If we don't know, there's every reason. There are very eminent researchers here who are saying there's every reason to believe that what's going on in the States, we're seeing similar trends in Canada, but we don't know. We don't have the data. Things, there could be variation, things could be different. We need the data, and that just is something that has to happen as well. So these are for us, for Breast Cancer Action, these are two big issues that we can change, that with mobilization and public pressure, we can bring these things about. So, or at least we'll try. So
I, with all my heart, hope that this bill goes through as written. And I mean, you mentioned that it might not be as strong as you like, but at least you get your foot in the door, and hopefully then that starts the road for change, right? You
Yeah,
got to start
exactly.
somewhere.
You have to start. You have to start, and you have to push. Yeah, absolutely, Josie. Mm.
So turning it over to Reena, how can your work inform future change-oriented action?
Thanks so much, Josie, for the question. And Jennifer, thank you so much for sharing really the importance of regulation and what a timely time we're in now, and how regulation around toxics really falls short, not just regulation, but the enforcement of the existing regulation as well. So in terms of my work, as part of sort of the workshops that I mentioned in the previous answer, we also discuss solutions. So having named sort of their workplace health harm, so that body mapping piece, and then trace them to the sources in the nail salon, so that hazard mapping piece, we ask participants, well, how do we create healthier nail salons? The potential solutions were divided into what customers can do, what nail technicians can do, what salon owners can do, and then what governments can do. And for me, this kind of solutions piece was really important because it really reflects, centering workers' voices. And I think that's so critical in this context. So while the participants recommended some individualized actions at the customer and worker level, they also discussed the importance of standardized sector-wide solutions. Broadly, the solutions identified can be grouped into accessible training, legislated and enforced occupational health protections, and improved labor rights. So again, given the focus of the webinar, I'll highlight the chemical-related solutions that were identified in the workshops. So in terms of what customers can do, the participants stated customers should not ask for acrylic nails due to the dust exposure. In terms of what fellow nail technicians can do, they suggested closing containers properly, as well as generally maintaining a clean environment. In terms of what salon owners can do, they mentioned that owners should offer training, they should provide non-toxic products, and they should also provide PPE. And then finally, in terms of what the government is responsible for, they mentioned health and safety training, as well as better access to health and safety protections in the workplace. And importantly, the participants stated that all the training should be accessible. And what this means is that they should be language appropriate, they should be free, or they should be offered with generous financial support. So that's, for me, kind of two layers, right? The actions individuals can take, and then the state's responsibilities to ensure widespread protection. So you have the individual level and then this kind of policy level. However, for me, there's an additional layer that I would encourage us all to sort of think about at least. So nail products and other personal care items, they come from somewhere. There's a vast, often global chain of production. So I mentioned earlier, in part, my work traced select toxics in nail products to their roots in petroleum extraction. Specifically, I linked petrochemicals found in popular nail products to their creation, use, and emission levels in Chemical Valley. Chemical Valley is a petrochemical hub in Sarnia, Ontario. It borders Aamjiwnaang First Nation. And Chemical Valley is site to 40% of Canada's petrochemical industry. A kind of an interesting side note, so recently there was some public outcry due to heightened benzene levels in dry shampoo. There was a recall, I think it was about a month or two ago. However, the decades-long heightened benzene emissions in Chemical Valley received comparatively less outrage from the media and from the broader public. So I think that's kind of something like to ponder, to think about. So back to this idea of tracing nail products to sort of the petrochemical industry. It shows that nail products, as with many other personal care items, are caught in sort of these broader webs of violence, webs that start in places like Chemical Valley and produce their own environmental violences well before they reach the nail salon. So to, for example, remove certain harmful toxics from nail products is beneficial and it's vital for nail technicians' health and well-being. However, it does not necessarily improve conditions at the source, right? So sort of in closing, I kind of want to encourage folks to sort of ponder this. And if we're thinking about justice, which is not individual, it is collective, we really need to interrogate, to name, and to responsibilize violence at its source. We need to sort of uncover these many layers of harm harm that these toxics do. And for me, this is sort of at the core of what we're talking about when we think of environmental justice.
I'm loving that you're digging so much deeper than your original thesis of just the nail technicians and how they're affected, but you really dug so much deeper, just to uncover all the different injustices that are being done. And I commend you for that because, man, there's a lot of change that needs to happen there. You're taking on a lot of big industries.
Yeah, there's absolutely so many connections and so many layers between so many different sites, you know, and I think it's important work. I mean, it's long-term work, but it's important work to sort of uncover these connections and sort of name violence at its source.
Incredibly important. Thank you so much, Reena. Anna-Liza, how can your work inform future change-oriented action?
Well, I'm going to keep it brief because I know we just have a few minutes left, but Reena and Jennifer, those were, again, such wonderful comments. So here's my rapid fire tips here. Regarding the sourcing that I mentioned, regarding there might be a bit of a financial outlay. First, you know, nobody needs to break the bank over this, right? Just take a really good look at your finances and be realistic, right? If there's that choice between whatever, rent, groceries, and getting a wonderful non-toxic product, you know, make the choice that you need to make. What I did was I got a group of friends together and I said, hey, I'm going to be buying some things. If you want to join me, that's cool, because there might be some products that I have some cash outlay on that don't work for me, that they don't, you know, that it's just not working. Maybe I can trade that with you. That was a really good thing. I'm also going to put a link into the chat. Some of you may know the Environmental Working Group. They're a fantastic resource. Please go to this link, and they assess a variety, like literally thousands of personal care products, and they assess their toxicity. They have on other parts of their website, they have some research. They also have some different sections for specific types of products, sunscreen, personal care, you know, so on and so forth. When it comes to the making of the products, I'm going to mention just a few that are nice to have on hand. I mentioned the beeswax, sweet almond oil. You can get that at the health food store, or olive oil. We think of that for food, but it's actually a really moisturizing oil, especially for the hair. You can, you know, you want to have some face scrubs, grind up some almonds, grind up some oats, right? You just need to get a bit of roughness in there. You know, talcum powder is very problematic for a number of reasons. Some fine white clay might work well there. In terms of essential oils, tea tree oil is the best antiseptic, I think, known to humankind. So definitely think of that. And, you know, lavender is a really nice, relaxing one as well. And just remember, a little goes a long way. And I would also say that from a cultural standpoint, ask your aunties, ask your granny, because look, plants are the original medicine, but they're also the original personal care products, right? So in terms of that cultural aspect, go back to the source, right? If we're feeling so much pressure to do these things, there's so many things that plants, that nature, that various minerals have to offer that are already there. And finally, you know, just a quick word about the CEPA advocacy that's been mentioned. What I didn't say is that my degree is actually in environmental policy. And I did this long ago enough that I've seen a couple of rounds of this, of CEPA now. The current round, it's been a really long time. It's been decades. And as Reena and Jennifer have mentioned, there's a real opportunity here, right? So when something is going to come up for discussion, there's a limited time period. So I do encourage all of you, all of the links that were put in here today, just take a couple of minutes, you know, and send a letter, because when it comes to government advocacy, there is the work of groups that's very, very important. But please don't forget, ultimately, the government is here to represent us. And is the government perfect? Absolutely not. But we need to understand how the mechanisms work, because we are lucky to be living in a democracy. Again, it's not perfect, but here we are. And the way to engage with that is to do things like keeping in touch with your politicians and let them know what you're thinking. Because if we don't do that as citizens, then they simply won't know. And I'll leave it there.
Now, I just wanted to ask you one quick question, because we had one of our audience members have a question about greenwashing. So do you have any advice for navigating the greenwashing of products? They find it very difficult to decipher which products are truly natural and safe to use versus those that are marketed as such, but in reality contain harmful ingredients.
Well, yeah, that's an important question. Thank you for that. The quick answer is, if you see an ingredient that has half the alphabet, you know, in there, in that one ingredient, or you might not even be able to pronounce it or read it, chances are it's not natural. So that's the first thing. But the second and larger issue is that the laws in this country do not allow us to actually know what is in these products. So sometimes it's not even a matter of reading the label. It's the fact that we need more label transparency. And I'm also going to leave that there because I believe the third webinar in this series does get into that topic specifically. So my short answer is, look for what's on the label and look for things that are hopefully not this alphabet soup kind of situation, but also remember that we can make choices as a consumer, but there's certain choices that are being made for us, right? We cannot make the choices that we need to make if the labels are not transparent, and if what is actually in the product isn't on there, then that also gets in the way of our democratic rights and freedoms.
Thank you so much for sharing, Anna-Liza. That's actually a little bit scary that labels are not transparent, but the more we know, right? So this concludes our first webinar in the series, The Environmental Injustice of Beauty. Thank you to our wonderful panel of speakers for their valuable time and insights, and to everyone for joining us in this important conversation. Thank you so much to Jack and the Canadian Association of Nurses for the Environment, CANE, for their amazing work putting together the technology for this webinar. And lastly, thank you so much to Ingrid for bringing all of us together on this important project. Please take a look at our website and social media pages to get engaged in the conversation. If you're interested in continuing the conversation, please see our Eventbrite page to register for the second and third webinars, which are going to be held on February 22nd from 6 to 7 Eastern Standard Time and March 1st from 6 to 7 Eastern Standard Time. We hope to see you all there. Take care.
Thanks, everyone.
Thank you.
Thank you.